Monday Night Spark. Have you ever experienced foot pain and you're frustrated that you're receiving the wrong advice and that your foot and ankle pain is not going away? I know I have been there. I was not taken seriously. I was ignored, and I was told I shouldn't be a runner. Well, that resulted in a total of 48 road races to date, 20 half marathons, 1 full marathon. And if I only knew what I knew 8 years ago. So in this live stream, I'm going to be sharing my story with you and giving you 3 tips to combat your foot and ankle pain so you can continue running, doing the things you love. So if you've ever been on that long run and about mile 5, mile 6, mile 7, you started feeling ankle pain or foot pain, then this live stream is for you. All right. So as you guys are coming here on the live, I just want you to type in live. If you're coming here on the replay, I want you to type in team replay. So I give you a shout out. I know that you were here. It is holiday week, as you could tell from the festivities. We've kicked off the holidays in the Scotty household, and hopefully you guys, if you haven't checked it out yet, go take a look at the Scotty Holiday Light Tour my cousin and I did during our annual Scotty holiday party this past weekend. Check out the lights that I set up outside. And if you've ever struggled with this foot or ankle pain before, what I want you to do is I want you to kind of drop your diagnosis, or I want you to drop where your pain was. So where your pain was hurting. Sundar, what's up? Thanks for jumping on here. I want you to drop where exactly you had pain, because that will help guide the conversation for tonight so I can kind of better help you, and we could talk about some of the specifics that you've experienced for yourself. So for those of you that don't know, I'm Dr. Dwayne Scotty. I'm a physical therapist with Spark Physical Therapy, where we help runners stay on the pavement doing what they love without pain, rest, or multiple trips to the doctors. So kind of how this all started out and why I wanted to talk about this topic tonight is because of a lot of stories I've been hearing from runners of late that I've been working with. And I do tend to hear the same story over and over again. And then my wife and I, as we were out on our long run, she crushed another 11 miles. We're going to be running the Disney half on January 11th. So it's going to be our first half marathon. So I'm so proud of her, because she has said to herself that she's not a runner and she would never be able to do it. And she is doing it. And I was there before. I've been there before. And it really takes me back to kind of my story on when I started becoming an adult onset runner. Cameron, thank you for jumping on here. Good to see you. Morgan, thanks for jumping on here. Guys, as you're coming on here on the live, if you want to type in live, as well as let me know if you've ever had any ankle or foot pain, and if you've been given a diagnosis or you had a specific pain location. So we're going to be kind of taking a deep dive into ankle, foot pain in runners, and I'm going to be sharing my 3-tip method on how to combat that foot and ankle pain. So Christine, thank you for jumping on here on the live. Good to see you. So going back to when I started running, I just started running out in the gym. So I worked out ever since college. I went through physical therapy school. So you learn about the body, you take anatomy, you take kinesiology, you start learning how what muscles, you learn all the muscles in the body, right? So it's nice to apply that knowledge that you're learning in the gym and started the strength train, workout. So I've always been doing that. And then I would say, so this is about 8 years ago. So when I was 32 and I started, probably around 30, I started running for cardio, right, in the gym, because I wanted to get some cardiovascular exercise, get a bit more lean. So I would run on the treadmill, and then I started getting foot pain. So I wound up seeing an orthopedic surgeon, so an orthopedic specialist for the foot, right, because I'm getting foot pain. So I see this orthopedic specialist. What does he do? Of course, he takes x-rays. So he takes x-rays. We look at the x-rays, and it looks something like this. This is a foot, right? So you guys can see these are bones of the foot. My foot has a 5th toe that is turned in like this. So they call that a bunionette deformity. It's the same thing for anyone who's had a bunion before, and that's the most common scenario where the first toe dips in here, causes pain on the inside of your toe. It causes lack of extension in your toe. That can be very painful in runners, especially running uphill, right? So I help many runners with that condition. But I had this bunionette deformity. He looked at the x-rays. He threw my picture up there. He's like, oh, your feet are the worst. Like, you definitely should not be running because your foot, it just can't run. So he really didn't listen to anything I had to say. I was very frustrated because I was a physical therapist, going in the gym, working out 5 days a week, being healthy. I was at, good body weight, lean muscle mass. And, this guy's telling me that I should never run again, that I have the worst feet possible. So I was not very happy to hear that. I really didn't follow that advice that was going on. I was having a little metatarsalgia. So it's just pain from the metatarsal bones on the bottom of your foot. Cameron says that she's live and that she loves the hat. Thank you very much. I got to get in the spirit. I'm very pumped. I'm very excited about Christmas, as you can tell. So we got the holiday decor going on in the background. Emmett, what's going on? Thank you for jumping on here on the live. Good to see you. So that was kind of my story there. And, it was a medical provider that I was going to that really wasn't going to hear me. And then he even brought up the possibility of surgery and talking about cutting my bones and doing like an osteotomy to cut my bones and make them straight. And I'm like, wow, this guy's like very extreme. But luckily I'm in the medical field and I know a little something, right? But I've actually come into contact with a bunch of runners recently that have, again, they experience pain, so they figure they need to go to the specialist, so they go to the orthopedic specialist. However, the orthopedic specialist is an orthopedic surgeon, and orthopedic surgeons do have a tendency to see things through their surgical lens light. And the majority of musculoskeletal injuries that you're going to experience as a runner are going to heal with conservative treatment, meaning you do not need surgery. So it is always good to get, number one, a second opinion, and honestly, see a physical therapist who specializes in working with runners, because you can, in the state of Connecticut, see a physical therapist without needing a referral from a doctor, and they are the movement specialist. They will be able to evaluate you and look at your movement and properly diagnose. If there was a red flag or something serious going on, we're also trained to refer out to the appropriate specialist if that is the scenario. So that was kind of my story, and it also brings up my wife's story. Over the weekend, as she was running that long run, this is the first time that she's running 11 miles, she started experiencing pain on the inside of her ankle. So the reason why she was experiencing pain on the inside of her ankle is because she was getting a little what we call posterior tibial tendinitis. So the posterior tibial tendon runs along the inside of your ankle. And if you are a runner who has flat feet, meaning fallen arches, we call that overpronation, which my wife is a huge overpronator. She has really, really flat, pancake flat arches. That causes overstretching, bowstringing of this posterior tibial tendon. And every single step you take as a runner, as you're running, that tendon needs to slow your body weight down even more so, and you can get overuse, tendinitis of this tendon. It causes pain on the inside part of your ankle and the inside part of your foot. Now, this was something that she was very nervous about, right? Which is normal. If you guys have ever been running and you felt foot ankle pain and you said to yourself, you started getting fearful, you started getting scared, just type in fear into the comment box, because you are not alone. And I promise you, you're not alone. I've felt that before. I continue to feel that every morning I get up with my mild plantar fasciitis heel pain that I'm experiencing. And it comes across in my head for a second, and I say, oh my goodness, is this going to be really bad where I'm not going to be able to run today, right? But what do? I do my stretches, right? When I first get out of bed in the morning, stretch out that fascia. We did a live on plantar fasciitis tips. So if you haven't caught that, guys, check out the topics or popular topics tab. So we are very organized here in the Healthy Runner CT Facebook group. And if you check out the popular topics tab, you will find Monday Night Spark. That has all of the live trainings that we do every Monday night. So if you are enjoying any of the content here today, check out some of the previous ones you've did. You'll probably find those topics helpful for you as well. So kind of getting back into I've been there before. So if you guys have been there, you're not alone. That's basically what I want to say. So let's kind of get into these 3 tips that I'm going to be talking about to combat foot and ankle pain for you as a runner. The first tip, what we're going to be calling is, this is going to be the MSA method. So shout out to MSA, Multi-Sports Academy. I was trying to come up with a nice little acronym to cover the 3 points, and I did come up with one, and it is MSA. So the first acronym, or the first letter, M, is going to be for mobility, and it's really going to be for ankle mobility. So this is the most common impairment that I see, meaning the most common positive examination finding when I evaluate a runner who has foot and ankle pain. They are 9 times out of 10 limited in their ankle mobility. So there's 2 ways that we can assess this. We can assess this looking at your joint mechanics. So seeing, is the ankle joint, so right now your ankle is made up of 2 bony surfaces. So the true ankle joint here, guys, is this talus bone right here, and it articulates with your lower leg bones. So really your tibia, and then your fibula is on the outside. And your ankle joint does this motion. So it flexes and extends, or points. So this is, we call this plantar flexion, we call this dorsiflexion. So your ankle's ability to dorsiflex and flex up is usually limited in many of the runners that we see. So you can do this by, you can simply bring your foot up and see, does it go as far as the other side? The other thing I like to do is to put my runners right against a wall, have their foot here, and do a lunge forward. So like bring their knee into the wall, and then I could measure and see how much flexion we have at the ankle compared to the other side. And 9 times out of 10, you do it on one side, the unaffected side, that's not painful, and then you compare it to the painful side, it's usually limited. So what does that require? Luckily, that's a pretty quick fix. There are some great manual therapy techniques that a good manually trained physical therapist can correct. We do a nice little ankle manipulation technique to kind of free up that joint there. We can also mobilize the joint. We can also do a mobilization with movement to help get that ankle moving. So ankle mobility in the joint as well as the soft tissue. So what is the soft tissue? Let's pull out my soft tissue model here. So my soft tissue model is the calf muscle. So there's the foot, there's the ankle. You got your Achilles tendon here. You have your calf muscle here. If this muscle is tight, so there's less mobility in your calf muscle, that's going to restrict your ankle in flexing forward. So that would require soft tissue techniques to this calf muscle. So there are things that we can do in the clinic, whether it's dry needling, whether it's taking the instruments and doing some soft tissue work, whether it's soft tissue work with our hands, or foam rolling or stretching. So I did a live on soft tissue techniques in the past, as well as a blog post on the sparkyourtraining.com website. You will see a blog post on soft tissue techniques to help runners. So those are the treatments that would help with this ankle mobility problem. So ankle mobility is the first tip, first thing that you want to assess. So Crystal, thank you for jumping on here live. So sorry, I forgot to tag you. Susan, thank you for jumping on. Tara, good to see you. Thank you for jumping on. Guys, if you're coming in here on the live, what I want you to do is put in the comment box if you've experienced foot and ankle pain before, because I know a lot of you have. This is the most common area for runners to have injured. So if you've experienced that, type in a diagnosis, whether it's heel pain, plantar fasciitis, tibial tendonitis, ankle tendonitis, heel spurs, bunion, what else? Peroneal tendonitis, Achilles tendonitis, tendinopathy, heel pain, whatever diagnosis you've been given before, or give me pain location, pain on the bottom of your foot, pain in your toe, pain on the bottom ball of your foot. So all of those areas are common areas that runners can have pain. So type that into the comment box. I would love to be able to answer any of your questions here on the live. Susan, thank you for jumping on. Deb, good to see you. Thank you for jumping on here on the live. So that was kind of assessment number one. Tip number one is check out your ankle mobility. See if it's limited on the affected side versus the unaffected side. Tip number two, S, foot stability. So foot stability is going to be the most important thing you can do as a runner. So it's just so funny that as we're here on the live, unfortunately, my notifications was not messed up. And I actually just received a notification from the patient I just treated before who is limited in ankle mobility. We actually did those techniques that we just talked about. And I just saw the message that said she's feeling great and that her ankle is moving and she was just able to do something for the first time in a long time. So I love messages like that, by the way. I love keeping active adults, athletes healthy, doing the things they love. And so that was just apropos that message just came across as we were talking about ankle mobility. So now we're going on tip number 2, ankle stability. So the bottom of the foot muscles, here we go, muscles again. So the bottom of the foot, there's a fascia under there. We talked about that in our plantar fasciitis live. Here's the fascia here. It's connective tissue. Underneath the fascia, these are all little muscles. There's tiny little muscles in the bottom of your foot that help stabilize the structure of your foot. So going back to my wife's scenario that we were talking about, the pancake foot, right? The really flat foot, flat arch, fallen arches, overpronator, that type of foot really needs foot stability. So your bottom foot muscles, what they do is they help build up your arch. So if you can activate those muscles under your arch, then those muscles can help stabilize your foot a little bit better. So when your foot hits the ground when you're running, when you're getting those contacts, those repetitive contacts while you're running, those muscles will help stabilize that arch, all right? So the simplest exercise you can do is what we call the short foot exercise or foot doming. And if you want a video to the foot doming exercise, just type in foot doming exercise. I'll shoot you the link on how to perform this exercise correctly. This is really, honestly, step number 1 to getting the activation of these foot muscles. Once you're able to activate them, and trust me, like when I first learned about this exercise about 4 years ago, they're actually doing a lot of research for runners on this exercise in the labs, in the motion analysis labs. And I started doing this exercise. I literally couldn't do it on my left foot. It's still challenging for me to do it on my left foot. I can do it on my right foot. I'm actually doing it right now. I'm able to dome and activate those muscles, but my left was really hard because it's more of a motor control issue, meaning signals from the brain, send them down to the muscles, learning how to activate those muscles. That takes a little training, that takes a little time. So don't get frustrated if you don't feel it initially. What you need to do is you need to keep working at it so you can feel those muscles activate. So it's that short foot exercise. Check out foot stability. So Deb says, hi, how you doing, Deb? Crystal says tendonitis in both ankles and plantar fasciitis worse in one foot more than the other. So it usually is worse in one foot more than the other, Crystal, and it's usually attributed to tip number 1, ankle mobility. That's usually limited on that side. Deb says tendonitis in her ankles. I'm always been told I have weak ankles, even growing up as a swimmer. So Crystal's going to get the foot doming exercise. And Lauren, thank you for jumping on here on the live. And Deb says foot doming exercise as well. So I will give you guys that link for that foot stability exercise. So tendinitis, guys, just simply means overuse. It's a repetitive overuse injury. When we're running, it's a repetitive overuse. So like my wife right now, because this is her first time ramping her mileage up. So she's running more miles than she's ever run in her life on a weekly basis. And we have her going on a beginner half training plan, and she's killing it. She's doing great, but she's getting a little tendinitis because she really hasn't built up the foundational foot strength and ankle strength before running. So this kind of brings me to my other point, and I am all for everyone being active. Obviously, that's what I promote, right? I want you guys to be as active as possible. However, I do need to tell you that I caution, especially for the full marathon distance. After training for a full marathon myself, and I only did that after 6 consistent years of running, meaning running all year round, running different training cycles, ramping up, ramping down, doing all of my running prehab exercises, increasing my half marathon times, adding in speed work, and doing it kind of the right way. I do get a little nervous when I meet a lot of novice runners who have the goal of running the full marathon. Not because I'm trying to say you can't do it, but I just caution because I have come into contact with many runners who get injured along the way. So the full marathon distance, in my full true medical opinion, unless you are, and there are some out there, I'm working with one right now who is like a freak of nature and can ramp up their mileage to incredible feats without ever running. But for the most part, 90% of us out there, it's going to take your body time to adapt to the demands of running, which means you should be running consistently year-round, running many half marathons before you run your first full marathon. So that's kind of my thoughts, just because we got on the tendonitis topic, and usually that's what I see. And then runners get frustrated because they're injured, and they say running causes me to get injured, and then they have this negative connotation with running. I want you to love running. I want you to run for the rest of your life. So my recommendation is to really build your body up slowly and don't rush the process. Like, running is a journey. You're going to be hopefully running for the rest of your life. Like me, I hope to be running. I hope to be getting that medal at that 5K, at that half marathon, the 80 age group. Like, I want to place in the first 3 of my age group. I want to kill the 70s and 80s division. If that's you and you want to kill the 70s and 80s division, just type in lifelong runner into the comment box, because I think that's our goal. And if that's our goal, if we're in it for the long game, then you got to play the long game and do it smartly and kind of build up over time. Don't rush the process. So that's kind of my take. Got on a little soapbox right there, but I know I had a bunch of questions about that, and everyone's starting to talk about what are their running goals, right, for 2020. And I think we just need to be careful when we set those goals and don't jump up too quick from what you did last year. So either keep your same distances for your races, but try to increase that time, or maybe add an extra race in the calendar, right? So run another half marathon if you ran 1 last year. If you ran 2, run 3. But be careful with kind of increasing your workload too much, because that's how you wind up getting tendinitis, especially around the ankle. So now the other point about tendinitis, guys, for you, Crystal, Deb, I know you guys mentioned about tendinitis, is if it's chronic, if it's been going on for a while, that chronic tendinitis is not really a tendinitis anymore, meaning itis, it means inflammation. So if it's been going on for months, then you don't have inflammation there. What you start to have is what we call degeneration. So now the tendon morphology, so the structure of the actual tendon, is starting to change, and it's become degenerative. And the reason I say that is because your treatments should be totally different. Because in the chronic phase, your treatments now need to actually stimulate healing in the tendon, load the tendon with specific exercises that are going to aid the tendon in healing, as opposed to a true acute tendinitis like my wife just got running 11, where she wasn't experiencing that pain, but then she felt the pain and it was a little irritable. What was the treatment for that? I told her to protect it, rest it. We actually did some NSAIDs, some anti-inflammatories. You can ice it. You kind of back off a little bit for that time period because you need to calm it down. That's a true tendinitis. But if it's more chronic and it's something you've been battling for months, then there are other specific exercises you need to be doing to load that tendon in order to allow it to heal. So I hope that makes sense for you guys. If that makes sense, and if you've ever had a chronic tendon problem, let me know in the comment box. Sundar says, yes, base mileage is important before starting marathon training. I know you agree with that, Sundar. You did your marathon last year, and you kind of experienced some of those, struggles. And, myself, when I did my marathon, I did have a little bit of pain periodically from time and time again. But again, like I'm telling you, I was doing everything like 110% right as far as my training, as far as making sure I'm training to run, strengthening all those muscles. I made sure there was nothing what we call as an impairment as a physical therapist, like anything limited mobility or flexibility or strength. So like having one hip weaker than the other, which so many of you do have, and you might not know about it right now. I made sure I was symmetrical because I had hip surgery, I had a labral repair, and my hip on that surgical side was weak for 2 years. Even though I was strengthening it, I was doing all the exercises in the gym, it took that long for it to actually get equal to my other side. So Crystal says she's hearing you on that one, not married to the idea of doing it this year, but definite future goal, full marathon. Yes, Crystal, I would agree. I think I think especially if you're having some of these symptoms right now, you definitely don't want to think about training for a full marathon because those symptoms will only get worse. Then the other thing is you need to get some treatment. Carly, good to see you. Thank you for jumping on here on the live. Your ears must have been ringing last week when I was with your buddy and we were talking about you. So Deb says lifelong runner. Heck, I would like to place in 20 or less in my age group. Stephanie, thank you for jumping on here on the live. Thank you. I'm glad you like the hat. Crystal says, like the chronic roller of the ankle for many years in my 20s, probably more degenerative. So actually, another good point, guys. You guys mentioned chronic weak ankles, so ankle sprainers. So if you've rolled your ankle chronically, then yes, you do have some probably ankle instability where your ankle joint probably moves around too much. And you really need to be careful with uneven surfaces and watch when you're running, especially with the ice and the snow. I actually just stepped in the other day when I was running with my wife. That was the day of the puddles. It was raining. We're running in the rain. And I stepped in a puddle. I didn't know there was like a little pothole there. My ankle literally rolled. But luckily, I'm not a chronic ankle sprainer. My muscles were able to react and kind of prevent my ankle from actually spraining. Deb says, my ankle is super sore toward the end of training for Hartford and a little while after the race, and I haven't ran too much since Hartford, so it's feeling good. And then, so Deb, the key to this, and this is what's very common, is most runners who are injured will go to the doctors. They'll say, stop running. They'll say, you need to take a break. And depending upon the injury, you may need to take somewhat of a break. But what happens is if you do nothing, you're not going to have pain. But then you start running again and your pain comes back. So you need to really find the true root cause of what's causing that pain. So going back, tip number one, is it ankle mobility, where you don't have enough mobility in the ankle? Or is it foot stability? And it sounds like you've had some chronic weak ankles in the past. So ankle strengthening exercises would be a good thing. Stabilization of your foot muscles. So that foot doming exercise you're going to start doing when I send it to you, and then strengthening exercise for your ankle. So now let's get into tip number 3. Final tip is going to be looking above. What do I mean by that? So this is the A, above. Looking above the foot and ankle, because usually foot and ankle problems are not only caused by the foot and ankle region, they are caused from above. Looking specifically at the hip, because the hip rotates in all 6 planes of movement. So your hip rotates in and out, like if your toe in or out, if you're like a toed in runner, some people do that, or they toe out, that's coming from your hip. That's not coming from your foot and ankle. But if your hip muscles are weak, or your hip is just the way you were born, your bones are rotated. If you were a W sitter as a kid, then you're kind of probably a little knock-kneed or toed inward, and your toes go in. That's going to cause more of that overpronation. It's going to put you more at risk for that posterior tibial tendinitis. It's going to put you more at risk for plantar fasciitis heel pain. It's going to put you more at risk for getting pain in a bunion, because you're going to push off the inside part of your toe. That's going to cause your toe to go inward, and then you're going to get this nice bunion, and you're just going to think, well, it's because I wore tight-fitting shoes, or I was a dancer as a kid, and that's what caused my bunion. Your bunion was caused by the mechanics of your walking and the mechanics of your running. That's how a bunion forms over time. So how do you treat it? You think about the root causes of what caused it to begin with. So looking at the hip, finding if it's a kind of a structural issue or if it's a strength issue, then I've been posting a bunch of hip strengthening exercises. And if you're not strengthening your hips for running, then we have some serious issues right now. You need to just like stop this live right now, head over to the Spark Your Training YouTube channel, go to playlist, hit exercises. You're going to see like probably, 30 hip exercises now. Where I would start with the clamshell. Start with the clamshell. That's the heavy hitter. That's the large rocks that will give you the biggest impact initially to fire up the external rotators in your hip. The external rotators in your hip are the anti-pronation muscles. Most foot and ankle problems are caused by too much pronation. So again, that flat arch feeling, you want to strengthen the foot stability muscles, but also the anti-pronation muscles. So the ones up the hip. So you got to activate those hip external rotators, find those hip external rotators first, activate them, and then progress. Last week, I did the standing progression. I called it hip with a mini band, taps, and circles. So then that would be the progression if you're already doing some good hip strengthening exercises or stabilization exercise, activation exercise, whatever we want to call them. If you're already doing those, you know how to find your hip rotator muscles, then do the standing progression that I posted last week. I'm even going to give you my last progression, hopefully by the end of this week or early next week. So keep an eye out for that one. That'll be the last progression. So Sundar says, what are your thoughts about ankle weights? Will it help to strengthen and stabilize? Definitely not your ankle. So ankle weights are used to add resistance on the leg if you were doing, let's say you were doing thigh exercises, so quads, and you want to do straight leg raises. Sorry, it's hard to see where the camera is. So you're doing straight leg raises or kicks, you can add ankle weights as resistance. If you're walking around with ankle weights or running with ankle weights, that does nothing for you except add more load down into your leg. So that doesn't add any resistance to any of your muscles because the load is actually pulling downward and it's just like sitting on your foot and ankle. So yeah, it makes it a little harder for you to lift your leg up, I assume. So maybe you're working your hip flexors a little bit more. That would be the only thing you would strengthen if you're talking about more of like walking or running with ankle weights. But ankle weights are traditionally used as an open chain exercise. I actually just saw a gymnast who's in a boot. She's in a cast, actually, unfortunately. Traumatic injury, fractured this little bone right here in the foot, and she's in a hard cast. So we cannot do, she's non-weight bearing. She's not allowed to put weight through it. So we need to maintain her leg strength because she's a highly competitive gymnast. And I actually gave her, and the actual cast itself is like wearing an ankle weight. That added resistance to some of our hip strength. And I gave her clamshells. We did the side wall lifts. We did straight leg raises. So kind of to strengthen up those leg muscles. So that's really going to give you the most bang for your buck with the ankle weights, Sundar. So hopefully that answers your question. Stephanie says, I never knew that it came from my hips. My feet tend to go inwards when I run and sometimes get toe pain underneath my feet. So yes, absolutely, Stephanie. It 9 times out of 10 is coming from your hips, unless your hips are in total neutral and you have significantly overpronation and your foot is collapsing, then you need to do short foot exercise first off. And it's because of the foot collapses, it causes your toe to go in and that causes the pain under your toe. So there is definitely things you need to consider. And that's really one of the things I do with my runners is when we meet for a first session is we do a full movement assessment to take a look at not only where your pain is, like you go into the orthopedic surgeon, you say, I have pain under my toe. He says, okay, pain under the toe. It could possibly be a bunion. It could possibly be a sesamoid. He looks at anatomy, right? And he says, what is the anatomy around that area? Could it be a tendinitis? There's a flexor hallucis longus tendon there. Could it be a bone? Could it be a bunionectomy? Could it be a sesamoiditis? Right? So that's what he will do. He will diagnose you based upon pain location. What I do from a physical therapy standpoint is I not only want to diagnose what is the structure, is it a tendon, is it a ligament, is it a bone, but what caused it to begin with, because that's how you're going to get it better. If you never get down to the root cause, your pain is always going to come back. So Crystal says, so would a lot of balance work in yoga help with strengthening your hips, legs, feet, and ankles? I'm finding it helps a lot with core. Absolutely, Crystal, definitely. However, I must say you need to learn how to activate those muscles first, or you need to make sure you are activating them when you are balancing on one leg. So whenever I'm balancing on one leg, I'm making sure my hips are level. So I'm using my side hip abductor muscles. You never want to be dropped, because then if you're dropped, you're actually putting more stress to the area. And then you're going to want to make sure that you're able to activate those foot doming muscles. So after you start doing that exercise, that will be integrated. That's really like the next level progression that I'll give my runners is once they can dome the foot, then we have them stand on one leg and have them do kicking exercises or exercise with the band with the other leg, or doing hip flexion, Captain Morgan style, which actually works your hip flexors on one side while you're working your foot stabilizers on the other side. So that's a very good progression. I'm glad you brought that up. Michelle, what's going on? Thanks for joining in here. I know it is not as chilly as it is where you are right now. And I'm very jealous because we're getting another snowstorm tomorrow morning. So many of us will not be running tomorrow morning. But what do we do when we can't run? We train. We train to run, right? So get into the gym as long as the roads aren't too crazy. Go early, because that's when I go. So even if the roads are bad, there's no one else on the roads at 5 a.m. So you're not going to get into an accident 9 times out of 10, or hopefully 99 times out of 100, right? So Michelle, thanks for jumping on here on the live. So guys, those are the 3 tips. One of the things I actually wanted to come on here because it's been a while since we've done this live in-depth training, and I really hope this stuff is helpful for you. But one thing that I want to do is, and oh my goodness, my Mac is going to be going to sleep soon because I'm unplugged. So we're going to have to wrap this up. But one thing that I'm going to do, guys, is I'm going to start to open up my schedule these next 2 weeks. So for those of you that don't know, I'm also a full-time faculty member. However, the semester is done and school is actually closed for these next 2 weeks. So what does that mean? I want to use that time to help you more. I want to develop more of a relationship with you. What I'm going to be doing is I'm opening up my schedule for a limited number of slots next week and the week after for 20-minute free consultations for my Healthy Runner CT friends. Because this one-way communication, and thank you all for those that commented today on the live, is great, but I want to be able to help you as a runner. I want to hear your running struggles that you're having, your injury struggles, be able to help and guide you with some free advice. So I'm going to be doing that for these next 2 weeks. So if you want to jump into one of those slots, I don't know how many I'm going to do because I got a lot of goals for 2020. I got big plans, guys. I'm really pumped, really excited. We're going to be doing some big things with Spark Physical Therapy and within our Healthy Runner CT group come 2020. So I don't know how many slots I could do, but if you want one of these slots, just type in Healthy Runner Call into the comment box. I will get in touch with you. We'll schedule that. It's totally free. Consultation. You will get to pick my brain about your running injuries, running struggles, and the things that you would like some advice and some help with. All right. I thank you guys for all of your support throughout this past year. Starting this group basically halfway through the year, and the amount of growth we've had has been awesome. And I thank you so much for doing that. Let's wrap up what was covered in this live. We talked about 3 tips to combat foot and ankle pain. And the 3 things we talked about is really looking at the MSA method. So shout out to Multisports Academy. That is the gym that I see my runners out of. It is a great gym right on the Farmington Canal line. So most of my runners who come, they'll do a warm-up right on the canal line, or we'll take a look at their maybe they're not having pain when they come see me, but they get pain during a mile or a 2-mile run, have them go out for a run, and then I'm able to properly diagnose their condition. MSA method, 3 steps to combat foot and ankle pain. Number 1, ankle mobility. All right, that's the M, mobility. Ankle mobility, assessing it, treating it, taking care of it. All right, there are a lot of treatments we talked about today that can help you with that, and we talked about how you're going to assess it. Number 2, ankle stability. Foot and ankle stability, really. Foot, we primarily talked about, is strengthening those muscles on the bottom of the foot, doming the foot, doing that activation exercise to get that foot stability. Number 3 is looking above. So that's the A, above, look at the hip, see if there's any hip alignment issues as well as hip stability, strength issues that is causing the pain down in your foot and ankle. So guys, if you found any of tonight's live helpful, please hit that like, hit the love button. That will just help this post be able to be seen on more people's news feeds. Those of you that are watching on the Spark Your Training YouTube channel, thank you so much for watching. If you haven't headed over to Facebook yet, head over to Facebook, join our Healthy Runner CT group. That is the kind of home base on sharing all this healthy content out there, whether it's injuries, exercises, nutrition, mindset, motivation, whatever you want to kind of do to stay healthy as a runner. That is kind of our home base. So head over there. And for those of you who haven't checked out the YouTube channel yet, you got a lot of free resources at your fingertips. So go check it out. Consider subscribing. And I hope all of you have an awesome holiday. I will talk to you again. We probably won't do a live training like this in depth because the schedule is really tight next Monday before the holiday on Tuesday. Tuesday is my wife's birthday as well on Christmas Eve. So I will not be working and seeing clients that day. So I got to get everyone in on Monday. So I probably won't be able to do an in-depth, but I'll jump on, do a quick live, wish everyone a Merry Christmas. Thank you all for those of you who jumped on the live, and if you came on the replay, type in hashtag Team Replay. I'll give you a shout out. All right. Hope everyone gets all their things done, their shopping done, their cooking done, their baking done, and get some running in there. All right. Stay healthy, guys. Stay active. Stay fit. I love you guys. Until next time. Bye.